Hello aspirants, I am Indumati Karthikeyan from InKar IAS Academy. Today we are going to see about the 28th November current affairs, which is taken from the Delhi edition, and the topic is schooling in India in times of poor quality. This topic is comes under our GS2 issues related to developing and management of social sector services relating to health, education, and also human resources. And also, it is comes under the topic of GS3 conservation, environmental air pollution, degradation, and also environmental impact assessment. The topic is actually what is the discussion is the schools are not the source of air pollution. Rather, there is a greater loss than benefit from school closure. While there are valid reasons for implementing other measures under the GRAP, that is the Greater Response Action Plan, that is in a stark reminder of the COVID-19 pandemic period. Schools in Delhi states in mid November 2024 as a part of a Great Response Action Plan to tackle air pollution, which is triggered when air quality index is very much poor, has been asked to switch from physical to online classes. While the other restriction imposed on a part of GRAP, that is a Greater Response Action Plan, might have an impact on air quality. The decision is switched to schools to online mode. That is a online is a good for safety and security for the children. So the poor quality air in many North Indian states is harmful for the age of the children. So the government of India will take care the action against this issue. This is the editorial topic today. That is in a stark of reminder of this COVID-19. Also, we done the same thing. But what are the things about this school air pollution? That is a harmful effect of poor air quality. That is a poor air quality in many North Indian states is harmful for many age group and not just children. The harmful health effects of poor in air quality are a continuous, and also there is a AQI causes the normal range. So the children for everywhere, the everyone in any age group should be protected from the poor air quality because of the respiratory systems disease, something like that. So the AQI standard is frequent of good air quality. There are only a few days in year when AQI is within acceptable limits. Other days, every day the air quality is very much poor. In 2024 till now, there has been even a single day with good air quality in Delhi is not considered. So there was just one good such air quality day in 2023 only. It is a naive to believe that AQI there is a more than 400 classified as severe plus harmful. Anything below this is not. So the arbitrary and high cutoff does not help except inadvertently. So the normalizing the harmful effect air quality. This is the range of AQI 51 to 399. So the indoor air quality and disadvantages for the children also happening. There is a more children in Delhi or other parts of the country are likely to have the same air quality inside the homes or in their school. So some underprivileged children air quality in the classroom might not better than at home. In many schools have air purifiers, but the idea having online classes due to poor air quality, that is a children will be additional disadvantage of learning the nutritional learning loss and also the nutritional loss. The children get midday meals in schools while there is no respite from the health impacts, and also there is a many more limitation on the online classes. That is it is widely known that online classes are not a replacement for the school based learning. The only beneficiary here are edtech platform and apps, but younger children are not supposed to have exposure to the screen every day, and also there is a force to attend online classes and also being exposed more on the harmful behavior than receiving any possible or perceived benefits. So first of all, we must know what is the importance of keep children going to school. That is a 3 years of COVID-19 pandemic. All of us have learned that schools are not the place where children read only books. There is a life learning. They focus on the keep school functioning and ensuring school continuity. There was an article related to this said the pathology of school closure in India, that is a very much affect the children's education. So to oversoul these ideas, the face mask, that is a very important idea which taken in the time of COVID. That time advisors on mask, that is a poor air quality nearly always bring up the issue of the face mask. Even before GRAP stages 3 and 4 recommended the suspension of physical classes, a few schools sent out advisories to parents, that is to children who would wear a face mask in order to attend the school. Though it was argued that these advisories were not to provide guidance, such advisories from schools became it is an informal mandate for children and also the parents, and also there's a lack of scientific backing for uniform mask mandate. Such a uniform advisory for children wear a face mask is not fully backed by science. During the COVID-19 pandemic, masks were not recommended for the younger children, that is less than 5 years, or for various scientific reasons. Also empirical data also state that the below 5 years students should not wear any masks. And also for those, there is a age between the 6 to 11 years, masks are advised or not, but or not, that is a mandate is not required for that. So there is no rationale for children where face mask is set up as an air purifier. Need for the nuanced approach, that is the approach, the face mask wearing guidance for children has to have a nuanced personalized approach. The school should refrain from issuing such advisories, and also the school such advisory should come only after guidance of the medical experts. And also we can take some scientific adoptions also, that is the school should not need to made a switch to online classes, no matter that level AQI. The focus should be keeping the school functional and also ensuring the learning continuity. And also they could be done on some mitigants, such as completely halting that outdoor activity in school when the AQI is poor. Everyone should appropriate the personal protective measures such as purifier and face mask, taking into an account recommendation by age. And also there is a pre-existing health issues also we need to consider, that is a pre-existing respiratory health issue are likely to benefit from the mask, that is wearing specifically in a polluted and also the open space. There is a second thing, there is no need of uniform directive to mask wearing, that is school or not source of pollution. Arguably that air quality in schools is similar to the home of children. Therefore it is not make any sense to do anything differently in school that when is done at home. If children or parents wear a face mask at home, they can wear it and our school as well. But except the medical recommendation, children younger than the 12 years should not made wear N95 masks. And also there is a during the period of severe above AQI children who have pre-existing health issue, and any parents that who wish to keep their children at home should be given an opt-out option, that is a physical classes, and the rest of the children should have to opportunity learning continually. And third thing, the school should setting whichever functional air purifier, that mask wearing is not going to provide any additional advantages. For such setting, school ensuring the classroom doors and also windows to be closed properly, and also switching on to air purifier at least an hour before the children would ensure quality of air. And also fourth thing, the online schooling is an oxymoron, that is a school teaching is online also other than air quality. These are other reasons such as foggy and cloudy winter days in many schools exercise as a reason of switching to online or hybrid classes. Should be a actively discouraged, and teaching should be physical mode for all. Parents are willing these things only, but offline or online, placing electronic device at the center of teaching for the learning. So we need to break this mode of thinking. Therefore, the future, the government of any authority of failed children by passing in order to switch to online classes. The management in every school meets to come at the innovative approach to ensure the learning and also in front of mobile or computer system. And the final thing is that is poor quality is a reminder anyone who has pre-existing health or respiratory conditions should take care of their health. There must be routine checkup, regular follow-up visit to the healthcare providers, preventive interventions such as annual influenza vaccination. So these appropriate recommendation vaccines or preventive interventions such as annual influenza vaccines, and also there is an appropriate recommendation of vaccines like pneumonia and measles, hemophilus influenza type B. So these are the things will be completely necessary for the children. So there is a policy should be in public centric, that is a policy from a larger social angle. Most of the action recommended as a part of grep adversely disproportionately impact the poor of the vulnerable to the terms of the wages, so as well as learning and nutrition losses occur to the children. So this is a reminder that the name of the policy should have a people centric and pro poor focus. So air quality and school functioning need a nuanced approach. So India had one of the largest closure of schools during the COVID-19 period, and we need to learn from those mistakes. There were another article also said that there is a building back to avoid a learning catastrophe will not will happen in April 28, 2022. So it will not again happen in this year. So we can conclude some air purifier and other things to reduce the air pollution. So what we conclude that the air pollution in the schools rather than the greater loss of benefit that is from school closure, while the valid reason to implementing other measures under GRAP to improve the air quality index, clothing, and also there is a school for physical classes makes the least sense for the children. So we need to go for the good and poor air quality, and also make sure that children should be in the good air quality circumstance. Thank you so much.